we can see this. This is going to be a different type of talk than we've had in the past. In the past, we've talked a lot about a specific illness. We've talked about antibiotics, headaches. This is more of an approach to medicine. There is definitely science behind this, but as you will see as we go along, I want to ask you to consider teaching your patients a way of helping themselves, which does not involve giving them medicine or doing a procedure or an operation. And we're talking about mind-body medicine. So what is mind-body medicine? This is a branch of medicine where we don't consider the brain and the body, or the mind and the body, to be separate, but we look on the fact that it's sort of one unit, that there are interactions between how our brain is functioning, what we're thinking, what we've been experiencing, and what's happening to our body. And that our emotional, our social, our spiritual beliefs, experiences that our mind is absorbing all can affect how our body is functioning. And if we want to look back in the history of mind-body medicine, this concept is not new. If you go back in Chinese medicine or Indian, the Ayurvedic medicine, this is a concept that 2,000 years ago, people were talking about. Not many times currently, but in the West. If you look at Hippocrates, of course, one of the fathers of modern medicine, he noted that what our moral or spiritual beliefs are could affect how we are, and it could affect our well-being. But then medicine changed, and we start to get many developments of a physical nature, the stethoscope, the blood pressure cuff, the blood test. We were able to look at the bacteria. We could do surgeries and fix problems. So then what happens is you get a separation. People look at the mind and psychiatric, psychological illnesses, and they look at the body, and they look at physical illnesses, the blood pressure, the diabetes, the hypertension, the cancer, all the illnesses that I'm getting questions about and you're facing every day. And often we don't put them together. So we think somebody's going to come in with schizophrenia or dementia or high blood pressure, but how do they work? And the question is, how common, I guess, are psychological problems? Well, there was a study, there are a number of studies have been done. These are studies from the West, so it's hard to relate them 100% to what happens in Kenya and other countries where the resources are not the same. But in the West, they're looking at 80% of patients have a psychological component to their illness. That's really high. Now, as you may know, the burden of illness in Kenya and your surrounding countries is some of the highest in the world. You're experiencing major medical, quote, in the old term of medical versus psychiatric problems. So it may not be as high, but clearly it does influence your patients. And then people have said, okay, if we're going to look at this belief into medicine, that the mind influences the body, what conditions could it affect? And look at these lists. These are all conditions that people have used, what I'm going to teach you in a few moments, how to treat. Anxiety, depression, chronic pain, headaches. We talked about headaches the other day, and we focused basically on what do we do to treat that headache? Do we give it a triptan? Do we give the patient a triptan if they have migraine? Do we give them a paracetamol if it's just a tension headache? Cardiac problems, high blood pressure, angina have all been treated in part, not 100%. We're not saying that you give up your traditional medicine. This is an additive. This is something that you're going to have in your armamentarium, in your tool bag to help your patients. Insomnia, GI problems, hypertension, as I mentioned before. So what we're looking at here is a way of helping your patients, which has not been, which is in addition to what you're already doing. And it may enable you to cut down on some of your medicines that you're using. Now, let's look at the history of this. At Harvard, Herbert Benson is considered probably the founder of mind-body medicine for the modern world. He started on early scientific studies. He didn't want to just look at what was out there in the literature. So he performed truly scientific studies, which nobody had done up until that time. And he coined a new term called the relaxation response. I don't know if you folks have heard of that or not, but it's common. He actually wrote a book, which is now out and became a 1 million copy bestseller when he started to do it. And the book was called The Relaxation Response. Interestingly enough, his colleagues at Harvard were very critical of what he did. They said a Harvard professor should not be writing a popular book, which is interesting to see. Somehow, to get to the next slide, maybe I could do it this way. No.
Dr. Hart, I actually uploaded the presentation on my side. We
okay, good. Could you go to the next slide, please?
Know.
I'm sorry. Okay, so what I want to teach you now is how to teach your own patients to do this relaxation response. This is something that is different, and I want you to approach just please with an open mind. It is terribly simple. I'm sure because of the fact that people here have gone through their medical training, you'll pick this up very, very quickly. And as we'll talk about in a little while, your difficulty may be asking your patients about this. So let's look at the next slide. You ask your patients to think of a word or a phrase that they're going to focus on in their mind. For example, some people say happy, joy, pain relief, any word they want to. The name of a deity, if that's in their belief system. There's no right or wrong word, but you choose one word and you remember this word. Next. You ask the patient to sit quietly in a comfortable position. That can be initially, if you have the time, which I don't know how much time you have with patients, in your office. Relax, sit back, or at home, sit in a chair where you're comfortable. Next slide. You ask them to close their eyes. So far, this is very simple. Sit down, relax, close your eyes. Next. You tell them to just think with their eyes closed about their body. Feel if your muscles are tense. Start off on your feet. Think about your calves, your thighs, your stomach, your shoulders, your neck. Just try and feel that your body's relaxed. There's no right or wrong way to do this. It's not something that you pass or fail. It's just that think, are your muscles relaxed? Are they tense? Let that thought pass through your mind. And this should take no more than 25, 30, 45 seconds. It's just a scanning of the body. Are they sitting there where they feel that their neck muscles are really tense? Yeah. And then we move on and you say to them in the next slide, breathe slowly and think of the word that you chose before. So if we chose the word relax, what you tell your patient to do is your eyes are closed. You realize that your body is as relaxed or tense as it is. Now, take a deep breath in and out. And while you're doing this, just think of the word relax. That's all you have to do. Now, some people say you breathe in through your nose and out through your mouth. You don't have to, but that's one technique that you can offer your patients. And the next slide, you tell your patients, if something comes in your mind, if you start to think of what you're going to do next, what you're going to have for supper, the fact that you had a headache, just try and put that aside. Don't get upset by it. There's no right or wrong. But if another thought comes in, just try and go back to that word relax. Next, try and do this for 10 or 20 minutes. You now know how to teach and do the relaxation response. So you tell your patient, just as a quick review, choose a word, relax, love, peace, whatever word you want, they want to choose. You can make a few suggestions to them. Sit in a comfortable chair, close your eyes, think about how your body is feeling. And you may want to start your feet, your legs, and work up. And then breathe in and out slowly, just thinking of that word that you chose. If another thought comes into your head, ignore it. Just keep going. There is no right or wrong way of doing this. But it's been shown that if people do this on a regular basis, it makes a difference. You don't expect to do it once and your problems are better. This is an ongoing practice. You think of the Buddhist monks who meditate every day. This is a modification. You're not talking about an hour sitting cross-legged and saying something in your mind. You're saying 10 or 20 minutes. And if they can do it twice a day, that's great. People who have trouble falling asleep, if they do that and they choose the word sleep and they're sitting there and or lying there, this is the ideal time. They close their eyes, they think of the word sleep, and they just breathe in and out. And it often will help them very gently fall off to sleep. Now, for people who use apps on the phone, you'll find that there are many apps which just teach you how to do this and then have sort of very quiet music in the background with somebody saying, you will breathe in and be aware of your in-breath and breathe out and be aware of the air leaving your body. You don't need to do that. You don't need to use an app. You can do that. I actually suggest, because I do this myself, I actually suggest that each of you who are listening consider doing this yourselves and seeing how it helps. Next, why does this work? You know, I've given you information about something which I don't know if any of you are doing now, but which may be, I would imagine, a new technique. Well, the next slide is some very interesting information. This is not a placebo effect, and you're familiar with the placebo effect. I tell you that this pill is going to give you a headache, and it's nothing but a sugar pill, and indeed some people will get a headache. Or I tell you this pill is going to take away your headache, and again it's a sugar pill, but it takes away your headache. That's the placebo effect. You give somebody a placebo, something that has no medical value that we know of, but just because they take it, they get better. Years ago, there was a procedure for abdominal pain, and this goes back, oh my God, I learned this in medical school, and they used to go into the abdomen and do something, and then one doctor decided, what I'll do is I'll put my patients to sleep, I'll make an incision just in the skin and sew it up and wake them up, and as many patients got better. So the whole procedure was placebo, just the fact of doing what people thought was surgery to cure their problem for a good percentage of people worked. So this is not the placebo effect. We move on to the next slide. It shows that here's a study for people who did the relaxation response. They got into the state of sort of a deep rest, but it changed their genes in the immune function, in their energy, and their insulin secretion. So just by relaxing, you had a change in your genetic function. So something is going on. Somehow the mind has influenced how our genes are functioning and how our body is functioning. So this is only one of many studies that are coming out that say now, okay, here is a technique that is drug-free, that is side effect-free. You can't harm yourself if you're lying back with your eyes closed, thinking of the word, breathing slowly. There's no risk in that. It's not like taking some of the medicines that we have to use for the illnesses we're treating, where if you know the side effects and you know what potentially that patient could experience. Doesn't happen with this. So then the question is, and we move on to the next slide, how do we get your patients to do it? And I use the word sell in a not a negative way, but let me give you an example. When I was in a refugee camp in Greece a few years ago, we had a woman who came into us. She was a refugee from Afghanistan, and she had pain in her back, but it was localized to one very specific area. I had a young medical resident with me, and after we examined her, and the only place that she was tender was in this one, almost at the tip of your finger area, I said to the patient, there is a procedure I can do where I inject lidocaine, which is a numbing agent, and that will take away your pain. Is that okay with you? And I explained to her the risks and what we were going to do about cleaning the skin of her back. And she said, sure. We said, excuse us, we had to go out to draw up and get our supplies. So as the intern is drawing it up, or the young resident is drawing this up, I said, okay, don't forget to sell her. She said, what do you mean? I said, well, consider the following example. A patient's in front of you, and you're adding a new blood pressure medicine to their medicine. And you say, here's another drug. I think it may work for you. I'm not sure. Some people like it, some people don't. I want you to try it. Versus, here's a drug which I have had really good experience with. And a lot of the people I give it to have no side effects, but their blood pressure gets a lot better. Which case do you think the patient's going to do better? And I think we do this all the time in medicine. If we believe in our treatments, if we know that we're doing the appropriate thing, we say to our patients, I'm going to give you this drug. It is the best drug for your condition. I am personally convinced that you'll do better. That's not false information. You're not lying to your patients because you've chosen that drug based on your knowledge, or that treatment based on your knowledge of that treatment. So you're telling the patient as it is, and I'm sure you've had experience with a lot of patients where you know you've put them on an ACE inhibitor and their blood pressures come down. So you're not mentioning to a new patient who's hypertensive that I'm giving you a drug I'm not sure about. You're giving them a drug that you've had good success with, you know has few side effects. The same with this. If you can try it and feel comfortable, then you can say to your patient, I want to teach you something. I know this is not what you expect, and I don't know enough about culture, because culturally, it's awfully hard sometimes to have people change what they're used to. One example of that from the refugee camp, people from Afghanistan, which was 90% of our population, were very unlikely to say to a doctor, I disagree with what you're suggesting. So if you say to a patient, I would like to give you this medicine, will you take it? They're tuned into saying yes, even though in their minds are saying, no way, my friend took that medicine and got really sick. But they won't say that to the doctor, say, yes, doctor, thank you. I don't know enough about the culture in Kenya and related countries, whether people actually say to the doctor, is this the medicine you would use? Or I've heard there's problems with this medicine. Or what do you mean you don't want me to give me a pill? You're telling me to go home and close my eyes and think of a word. Is that really a treatment? And you have to know your population, which I'm sure you do, like I do when I'm seeing patients in the United States or Canada, where I am now, or if you know that it is something that your patients are going to have some time or trouble, I guess, difficulty in accepting, to quote, sell the patients. I've been doing this myself. If you can see yourself doing that, I've looked at the information, I've listened to a talk about it, and it's remarkable the fact that here's something you can do in addition to the medicine I'm going to give you, and you'll improve. There we are. I hope this has been of some value. Everybody is going to get a copy of the slide. So this is, in conclusion, I'm sorry, I was going to include, this is an additional technique. It's not the only technique you use, but it's a technique that you can use. And since we've had a number of folks on this presentation, if you want to share this, you're going to get the slides with your colleagues. And if you find it useful, it is really, really helpful. I see we have some questions. I would, Malik, would you mind taking care of the, sort of asking the questions for me? Because and then I'll try and respond to them.
Absolutely. So we'll go with the first question. And the question is pretty blunt, and I just like to phrase it the way that the panelists asked it. Most of the time, work gets tiring and demanding and draining. So how do we tackle this? So I assume this is more of a stress relief and primary care question.
It's an excellent question, because with your burden of illness, one, do it for yourself. That's going to help relieve your stress in your practice. Two, how long did it take me to tell you to do this? This is 2 minutes of your time. It doesn't take long. It's not like we've been talking now for half an hour, give or take. It's not that type of thing. It's a very valid concern. When I've been in the refugee camp, we had 300 people show up in the morning. We could see 200 with all our providers. We were busy, we were stressed, but you can still take time to do it. If you're talking only a few minutes, and be selective of the patients. Don't do it with every patient. Somebody comes in with an ear infection, treat them. That's it. You've got a patient who you don't think is going to be very, very receptive. Start off with the patients you think are going to be more receptive to this and see how that works. Be selective. I'm not saying you do this with every patient. Be selective, try it. If you say, I'll do it on 2 patients a day, that's it. I'm asking you to find 5 extra minutes a day, 2.5 minutes per patient. And then when they come back, remind them of it, because people, like anything new, we may try it once or twice and then forget it. Sometimes you need to be reminded, and I don't care what that is about, to exercise every day. You don't know how long it took me to start doing regularly walking. My wife must have bugged me for 2 months, but it takes time and you can do it. Next.
That's a great question, Dr. Hart. And for the next question, I think in the midst of the COVID-19 pandemic, we've seen how how the delivery of healthcare has impacted healthcare workers around the world, especially when it comes to exhaustion. So for the second question, do you support health workers taking vacations after a long year of work? And what's the impact of stepping away from work for overstressed healthcare workers?
One is be a very positive impact. We all, for me, and I love medicine. I started wanting to be a doctor, I think it was age 4 or 5. So for me, I didn't find it, I was fortunate. I got tired after a day, but I love the interaction with patients. It can be very tiring. And after a lengthy stress with COVID, with everything else, sure, step away. Hopefully you have another hobby, interest, and I don't know whether that's going hiking, whether that for some people it's cooking, for some people it's photography. There's, do something different. If you're going to go, if you're going to take your break, definitely take your break, but not just to sit around and do nothing. Find something to occupy your mind that is enjoyable. Get some physical activity. So when you go back to your medicine, you're refreshed. But just don't take off and sit home and say, okay, I'm going to relax. That's not going to, I think you've got to give your mind a break. And by focusing on something different, I happen to enjoy astronomy. So going out at night when it's a dark sky and looking up with a small telescope, I find enjoyable. Everybody has their own enjoyment. I enjoy reading. I'll pick up a book on a subject and read it and do a number of things, go for my walk. So yeah, COVID has stressed all of us tremendously. The nice thing, and I don't know if there's any Zoom medicine for you folks there. I don't know what you have, but if anybody does have Zoom medicine, you can teach this over Zoom. You can teach this over a telephone. You can teach this over a cell phone. It's a simple technique, but please try it yourself. When you, now this is what, 10 o'clock at night for you or 8 o'clock at night for you? Was it 7 hours? It's 8:30.
8 hours difference.
Yeah, 8 hours. So it's 9 o'clock at night where you are. So I don't know what time you folks go to bed. Go to bed 10 minutes earlier tonight and try it. And then if you have time if you take a lunch break tomorrow, take 5 minutes. It doesn't have to be 10 minutes. Do it quickly. Get yourselves used to it. See how you'll feel better. And then it's a lot easier to help your patients when you're doing something yourself. If you believe in it and you've noticed that you feel better, and you will. I mean, with all the studies that are out there, if you were in Boston, Herbert Benson, who is still active and he's now an emeritus professor, still teaches a course that fills up for people coming around from around the United States to teach them what I just taught you in a few minutes. And they pay him, $400 or $500 to learn what you guys, I'm sure, have picked up already and can do. And don't forget, you're going to get the slides so you can review them. It's all there. It takes a few seconds to review. Are there a few more questions?
That's great feedback, Dr. Hart. We have 2 more questions that are
Super.
pre-typed. The next one is, what advice do you have for healthcare workers who may feel incompetent with the work that they do? And it usually stems from they feel as though they can't do enough for the patient.
Oh God, none of us can ever know enough. The trouble with medicine is there's so much new information. If I look back, I graduated 50 years ago, before I'm sure a good number of the providers here were born. Medicine has changed. It's not the same that I learned. Keep up to the best of your area. Keep up with the conditions that you've been seeing the most. You don't need to know how to treat the latest on pancreatic cancer. I don't think any of you there are going to be doing that. You refer a patient with breast cancer off, unless you happen to be a surgeon or an oncologist. Look at the areas that you need and study in those areas. I mentioned before, the New England Journal of Medicine is free to everybody in Kenya. We'll send out the link again, and they have great review articles on many topics. So if you're saying, I've got a patient, yes, you can ask the Addis Clinic, and yes, one of us can help you, but I'd like to sit down at my time and read a little bit more of the latest in hypertension, new drugs for diabetes, managing arthritis. I don't care what the topic is, the common things that you see, infectious disease. There will be review articles for free on the New England Journal, and these are all written by experts in their field. Now, the difficulty is that the resources that we wish everybody had, you don't have. So you don't have immediate access necessarily to an MRI or immediate access to the latest lab tests. But put that aside, just read and it'll give you at least an update. I constantly use a reference called UpToDate. Unfortunately, It's not free. I wish it was free because then I would make it available to everybody. But I've got a lifetime subscription to the New England Journal. These are resources, but the New England Journal is a wonderful resource where you can help you get a review. And don't forget, please, I mean, we're here at the Addis Clinic, and if you say to me or one of our other colleagues, I don't have a specific patient, but I need to have more information about managing patients who don't respond to the first line treatment of antihypertensives, that's a very, very important question. And we'll gladly say to you, okay, this is what we suggest. This is what the World Health Organization or the national guidelines are. And then you can fit that into your practice. And that goes across the board. I just chose hypertension, but diabetes, arthritis, whatever it is.
That was a really good answer, Dr. Hart. So the next one kind of follows in the same vein. Could you talk about the relationship between sleep and stress? And also, is sleep a preceding factor for stress?
Yes, getting a refreshing sleep is so important. And if you're stressed, if I'm stressed, and I don't think I'm different to you, you had a really difficult day. You had a patient who either got really upset with you, or a family member, or a mother because didn't think you helped their child enough, or you and you come home and you're thinking about it and you're thinking, what else could I have done? Or personal things at home with your family, finances, I don't care what they are. If you go to bed with that, you're going to be processing that. It's going to make you hard to fall asleep. In one sense, that's why if you look at a lot of the help for sleep problems, forget the medications, they're out there, but you don't want to use them because after a while they don't become effective. There are a lot of practitioners down in the States that teach people a variation of what is relaxation response to help them go to sleep. And if you do that, you say, okay, I've had that terrible day and I had that argument with my brother and I'm gonna, we're gonna get over it. But meanwhile, I'm thinking about it. Okay, I've chose the word peace and I'm gonna try. And if something drifts in my head about my brother, I'm just gonna think of the word peace and try and let it go out. It's not a failure if it comes back 20 times, but that may just help lower your stress level. If you lower your stress level, it'll be easier for you to drift off to sleep. There we are. I'm not trying to sell this. Maybe it sounds like I am a salesman. I believe it is great, but I'm not trying to please come across that it solves every problem. It doesn't, and it doesn't always work. I'm giving you all the positives. Some people, years ago in Massachusetts, there was a stress reduction program. A professor at the University of Massachusetts, where I was on staff at the medical school, set up a stress reduction program for people who had chronic pain and who were on narcotics or who had surgery and nerve damage. And he taught them not just one, but 6 or 7 different techniques of how to do stress reduction. And if you like, I could get into other, stress reduction techniques, write it up, and we can get it out to you folks. But he was very successful with the program because people were given a variety of ways of looking at their problem. This did not change what they were doing medically. If they were seeing a doctor and he was giving them pills or shots or whatever other type of therapy, this was an addition. And it really did help. It helped people cope with and live better with a chronic problem. And I'm sure you all have people who have chronic problems and you're not going to relieve it 100%, and they have to live with taking medicine and still some degree or more degree of discomfort.
That's great. We actually have a live question from Austin.
Sure.
So Austin, I'm just going to take you off mute. Feel free to jump in. All right, while we get Austin's audio together, we have another question. What is your advice on the use of drugs and alcohol to relax?
Stay away, as far away as you possibly can. Alcoholism is a major problem in the US. causing billions of dollars worth of damage. There was a study that literally just came out a few days ago, which showed that the amount of alcohol that's safe up until age 45 was an ounce a day, that it had negative impact on you. Personally, in the United States, it was called a medical examiner. I don't know the term in Kenya, but although I'm a family doctor, for part-time, if somebody died in a car accident, if they committed suicide, if they were murdered, I went out to pronounce them dead and worked with the police on the case. I can't tell you, and I did that for 15 years, I can't tell you the number of people who were drinking and driving and either killed somebody or were killed themselves or both. And drugs are addictive. And after a while, it's interesting, if you talk about sleep meds at night, the med is doing nothing. If you've been on it for a month, it's probably doing nothing. And if you took a sugar pill and believed it was a sleep pill, you would do as well, but your body becomes dependent upon it. So, I mean, I take, and I'm not trying to be holier than thou, I take only prescribed medicine by my doctor and nothing in the line of anything to relax, or stimulants, of course. And personally, almost zero alcohol, because I'm so afraid that if I went out to somebody's house and I took a drink, I'd be in a car accident or cause an accident. So maybe I'm neurotic about that. But I find that if I'm going out socially, if I have a glass of soda or a fruit drink, I can enjoy myself as much in the interaction, the conversation, as if somebody put alcohol in that drink. Now that's personal, and but please, as much as you can, one of the screening questions I'm sure you ask your patients is, how much alcohol do you take, as well as asking if they smoke. But alcohol is a serious, serious problem. And so are drugs, of course. Next.
That's really good, Dr. Hart. We ran out of the questions that were typed
Can
in
we
right
get
now,
the live question up at all, or no?
we weren't able to, but Austin, if you're available, please raise your hand and we'd be happy to put you live. But Dr. Hart, if you will entertain it, I have a few questions for you.
Oh, sure, of course, 100%.
How do you talk about stress management with a patient who doesn't believe they're stressed or doesn't believe that the stress is warranted?
I think you'd say that this is a technique that works even in people who are not, quote, stressed. So you can buy in for them, hey, yes, you're not stressed, when in your opinion, this is a stress-related problem. But even in people who are not stressed, and that's one approach. I don't know how successful you can be. I remember there was by saying to people, yes, you really are stressed. There was a question that I had, an excellent question from one of the doctors from the Addis program or clinic, who mentioned that the patient came in with many physical symptoms in many parts of their body. And my response back to them was, medically, things usually fit together. If you're having a headache, you can understand nausea or photophobia, trouble with the light. But you don't also get pain in your arms, pain in your stomach, pain in your chest, pain in your feet, feeling dizzy, many symptoms, that these can often be stress. Now, how you approach that, you can say to the patient, this may be a stress-related problem. And you can say, I respect the fact that you don't agree with me, but why don't we at least try this technique? Or why don't we at least look at this as a possible problem? I've got patients who I could never convince, and I knew it, and there we are. They had a fixed belief that they were not stressed, and that there was that one doctor who was going to find the cause of their multiple problems. And they kept going from doctor to doctor to doctor looking for. And there are some doctors who say, okay, yes, you have kumquat disease, the one disease I always make up, and this is your treatment, and give them a placebo pill. Is that valid? I don't know. That's an ethical question.
That's a really good question. And I think this is an interesting follow-up question, especially since you mentioned your medical school experience. How do you manage stress with medical school students or any student facing a lot of stress, especially around periods that invoke that stress, like end of year exams?
This is where you teach them techniques. If they're aware that the stress is coming, this is where you can directly address it. Look, at you're stressed, you're going to go into your exam cycle. You're going, you're just starting off in university or high school or whatever it is, or a new job. Here's some ways that you may be able to look at doing this. Here's some things that you want to think of. Let's list what things stress you. What are you worried about? You're not going to do well in the exam. Your family's going to be disappointed in you. Your friends are going to say, your friends are going to do better, and their families are going to say, look, Johnny did better than you did. And let's look at these one at a time, and how can we deal with them? So maybe you break down the stresses, the overall stress, into small components, and help them look at each component and say, okay, how can we cope with that? If you're talking about, we don't learn in medical school how to deal with the stress in the practice. Or maybe, of course, I'm sorry, I don't know about now. Although there was a change in medicine. When I went to school, taking care of yourself was not part of the agenda. It was take care of the patients. That's coming in, that I know is more in the agenda now. And there's got to be a balance. You've got to be able to say, okay, there are some doctors who say, this is all I can see. I can see 20 patients a day, and beyond that, that's it. And there's other doctors who say, I don't mind working later. We're all different. And sometimes you handle your stress by saying, I know what my limits are, and I'll have to set those limits and tell the person I'm with, this is my limit. Above that, I don't function well. Don't have an easy answer. It's an excellent, excellent question, but I wish I had an easy and sort of global answer.
No, I think that answer really pointed to the framework that you have to approach whenever it comes to stress management with your patients. And to that end as well, Dr. Hart, do these techniques work for special populations? For example, with the pediatric population, they're capable of stress, but will this work for them?
That's an excellent question. I have to look up the answer. For an older child, yes, 10 or 11 and up, you can teach them that. Maybe 12, I don't know what age. For the younger patients, no, I can't imagine. I know kids get very stressed, and they react to the stress. Let me reach out and find an answer to that question, and I will get back to you.
That'd be great, Dr. Hart. And we're nearing our end time. So I have one more question before giving you the stage to make your closing remarks. And I'm going to put you on the spot here. If you had 30 seconds and you had a global microphone to talk to everybody about why stress management is so important and why avoiding stress is important, what would your pitch be?
That this is a way of helping you improve the quality of your life, relieve many general medical conditions that we all have, hypertension, insomnia, anxiety, drug-free, side effect-free, and easy to learn. And I recommend everybody consider trying the relaxation response.
That's a wonderful closing, Dr. Hart.
Well, listen, it's a real pleasure. I really, really enjoy these presentations. Personally, I learn, even though I'm practicing this technique, just going online, looking at the latest information. So I love doing them. Please send through the Addis Clinic suggestions for what you would like to hear next. There's also other speakers who have volunteered on other subjects, so please let us know. And I know we will schedule more of these presentations. And I want to thank everybody who took their time, which is very valuable at the end of, I'm sure, a long day for everybody to come for the presentation.
Well, I can't think of a better closing. Thank you so much to everyone for joining. The webinar will be available on our YouTube channel by the end of the week, as well as Dr. Hart's notes and presentations. If you have any questions in the meantime, or you have anything specific for Dr. Hart, please send an email to malik@addisclinic.org. I'll drop it in the chat, or respond to the email you received before this webinar, and we'll make sure your question gets answered. But thank you so much to everyone for being here. And thank you again, Dr. Hart.
Good. And have a safe day, everybody. Thank you.
Thanks, everyone. Bye-bye.